Hello, Danny Blyth from the College of Integrated Chinese Medicine, looking at stomach syndromes. So we're going to look at qi and yin deficiency and fullnesses of fire, cold invasion, retention of food and stagnation of blood. Remember, this is for acupuncture students only. Please pause and read this. The stomach rots and ripens food and drink. It controls the transportation of food essences. It sends the qi downwards, and it's the origin of fluids. There's a saying that if there's stomach qi, there's life, and if there's no stomach qi, then there's death. So good stomach qi is associated with good prognosis, and it's depleted in chronic illness. It's called the root of post-heavenly qi. Pre-heavenly qi comes from the kidneys and the jing, and post-heavenly qi comes from food and air from the lungs. So if the stomach qi is strong, we get a pulse with good stomach qi, which means that it's regular and it's not too strong and not too weak, so moderate. And we get a rooted tongue coat. So if the tongue coat is nice and even, we get a thin white coat that almost reaches the edges. If it starts to become unrooted in the centre, that you could scrape it off, then the stomach qi is suffering. So we associate good stomach qi with having a good appetite and good digestion. Stomach receives food and drink and is involved with the first stage of digestion. It's like a cement mixer, breaking the food down and mixing it with digestive fluids. If this process isn't working well, then appetite's reduced and sense of taste is reduced, and digestion not so good. So very closely related to the spleen qi that does the transforming and transporting. And if the food isn't properly fermented or over ferments, then we get sour regurgitation, bad breath, indigestion. Works closely with the spleen to transport the food essences, the gu qi, around the body. If it's not working, we get weak limbs and tiredness. It sends the qi downwards, so from the stomach down to the small intestine where it does its separating and sorting, down to the large intestine where it does its final transformation and then excreted. And all of this happens under the control of the spleen. So two things can happen. Stomach qi can rebel upwards. We get belching, hiccup, nausea and vomiting, sour regurgitation, difficulty swallowing. Or it can stagnate in the epigastrium, so we get epigastric pain, fullness, blockage, constipation. Stomach's the origin of fluids. Obviously this is where the fluids enter the body. If the stomach fluids are deficient, we get dry mouth and throat, dry stools, cracked tongue, thirst, constipation. It needs a lot of fluids to digest, so the stomach produces 3 to 4 litres of gastric juices a day. The spleen likes dryness and the stomach likes wetness. So the stomach qi descends the impure, it likes wetness. The spleen qi ascends and ascends the pure, and it likes dryness. So with these two together, we get a nice balanced central fixed earth. They're an unusual pair. The spleen is the yin organ, but it has much more yang functioning, so its qi ascends, it likes dryness. Rebellious qi leads to diarrhea, piles and sinking of the qi, and it tends towards qi and yang deficiency, cold and damp, and has mostly deficient causes of disease. On the other hand, the stomach is the yang, the fu organ. Its qi descends, it likes moisture. Rebellious qi leads to belching, nausea, vomiting, hiccup, and it tends towards yin deficiency with empty heat or heat and fire and phlegm. Look at stomach qi deficiency first. If the stomach qi is weak, the qi won't descend and we'll get epigastric pain, but it'll be a dull, achy epigastric pain rather than a strong, full one. The gu qi won't get transformed, so we'll get tiredness, especially stomach time of 7 to 9 in the morning, and weak limbs. We can get signs of spleen qi deficiency, or at least they're impossible to tell the difference between. So poor or abnormal appetite, poor taste, loose stools, and then earth imbalance. Stomach yin deficiency, we expect the stomach fluids to be deficient. So the stomach's not rotting and ripening properly, so we get an abnormal appetite, poor appetite if it's more deficiency, hungry if it's more empty heat. The stomach chi doesn't descend, so we get dull or slightly burning from the empty heat, epigastric pain, slight fullness after eating, but mild. It's the origin of fluids, so if we get dry body fluids, we'll get constipation with dry stools, dry mouth and throat, especially in the afternoon, and thirst, but in small sips. And we might get empty heat signs of afternoon fever or bleeding in the gums, and again a general earth imbalance. I remember fire by remembering fire yard. So fire for fluids, fire dries the fluids and the blood. Yang pathogenic factor, it's more severe than heat or empty heat. It has an ascending nature, leads to reckless blood and bleeding, and it disturbs the shen. Looking specifically at stomach fire, it injures the fluids, so we get intense thirst and wanting to gulp cold liquids down, and constant hunger. We get constipation, dry stools, dry mouth, feeling of heat. It's a more severe pathogenic factor with an ascending nature, so it obstructs the descending of stomach chi. So we get a burning pain in the epigastrium, sour regurgitation, nausea, vomiting. That can rise up into the stomach channel, so we can get mouth ulcers, bad breath, swollen painful gums. We can get reckless blood in the stomach channel leading to bleeding gums, and we can get a disturbed shen leading to mental restlessness. If we add phlegm to the fire, we get a slightly different presentation. So phlegm obstructs the chi, we get epigastric or chest stuffiness or oppression. We get less thirst and hunger because the fire is dampened, and we get phlegm and mucus. It can also obstruct the shen, so we get more severe mental health problems. So fire agitates and disturbs the shen, phlegm obstructs the phlegm and disturbs reality. We can also get damp heat in the stomach, which is kind of like phlegm fire in the stomach, but milder and without the phlegm symptoms. Cold invading the stomach. This is normally a reaction to food or a stomach bug. So the full cold means the chi can't descend. So we get a sudden, severe, because of the cold, pain in the epigastrium, vomiting clear fluid because of the cold, and vomiting will alleviate the pain because it's full, and nausea. The full cold invasion, we also get cold limbs, preference for warmth and warm fluids, worse after cold fluids, which are quickly vomited up, and feeling cold. So this shows a rather kind of full acute presentation. You can also get stomach deficient and cold when the cold becomes more chronic and injures the spleen yang. Retention of food in the stomach, which I think is really underdiagnosed. We get fermented food in the stomach, so sour regurgitation, foul breath. The food obstructs the descending of stomach chi, so we get epigastric fullness, pain, distension. It's better for vomiting. Get nausea and vomiting of sour fluids and belching. There's obstruction to the spleen chi, and underlying spleen chi often with poor appetite, loose stools. The stagnation forms heat, and we get constipation, and that heat can disturb the shen and lead to insomnia. So this is that night that you lie in bed after eating a really rich meal feeling thoroughly awful. I remember blood stagnation by thinking purple plums. So purple, we get purple discoloration of the nails, eye sockets, we get purple blood, we get veins, the tongue can have purple spots, purple colour, purple veins underneath, nails, lips or skin can become purple. And then pain, which is fixed, severe stabbing, leaking of blood, which is purple, clotty. It's conditions unresponsive to treatment, chronic, and we get masses and swellings. With stagnation of blood in the stomach, we get severe fixed stabbing pain in the epigastrium, worse at night, worse with pressure, vomiting of dark blood like coffee grounds, pain after eating for the fullness, dark blood in the stools if the large intestines involved. So if we can also get stomach chi rebelling with nausea, vomiting, all of that blockage stuff. Think of our purple plums. We get purple blood from the vomit and from the stools. We get pain in the epigastrium, which is fixed severe stabbing. We get leaking of blood through the vomit or through the stools. It's unresponsive to treatment and chronic. And masses and swellings possibly, but they're not usually palpable in the stomach. In terms of pulse diagnosis, we'll see problems in the spleen and stomach position. If it's deficient, stomach chi deficiency, floating empty, stomach yin deficiency, empty heat rapid, overflowing and rapid, stomach fire, it's like it's bursting its banks. If we add slippery to that, phlegm fire, deep, tight and slow, cold invasion, full and slippery retention of food, wiry or choppy, stagnation of blood. In tongue diagnosis, tongue can really show us a lot about the stomach, especially the tongue coating, and especially at the centre of the tongue. So if it's pale and rooted, midline cracks, stomach chi deficiency, red peeled horizontal cracks and dry, stomach yin deficiency, the red with a thick yellow dry coat, stomach fire. If that coat is sticky with yellow prickles and a midline crack, stomach phlegm fire. A thick white coat for cold invasion, and a thick white or yellow coat, depending on whether it's heat or cold, for retention of food. A key symptom here is epigastric pain, so uncomfortable mild for stomach chi deficiency, dull slightly burning for yin deficiency, burning and strong for fire, sudden and severe stomach cold, fullness pain distension with stagnant food, severe and stabbing with stagnant blood. Etiology is quite complicated. If we just look at diet, poor quality foods or under eating weakens stomach chi. Irregular eating, missing meals, snacking, eating late at night weakens stomach yin and chi. Excessive hot foods, spirits, spicy food, sugary food heats up the stomach and leads to heat and fire. Greasy foods to phlegm fire. Too much cold food, iced food, raw food can lead to an invasion of cold, or polluted food. And then eating too quickly, overeating, eating when stressed, eating late leads to a stagnation of food. A few specific etiologies to look at. So stomach chi deficiency we can see in chronic disease, the link to prognosis. Stomach yin deficiency might be constitutional, might have a midline crack and a tendency to stomach yin deficiency. Might be the after effects of external heat. So if somebody's had a fever for quite a long time, that can really injure the stomach yin. Might be caused by medication, especially antibiotics or any medication which gives you a dry mouth, which is lots of them. Stomach fire or phlegm fire might be emotional in its origin. It might be an invasion from liver fire. Cold invading the stomach might be exposure to cold as well as food related. A special consideration of stagnation of blood in the stomach. It's secondary, comes from other long-standing patterns of heat-cold stagnation. So we see it in long-term stomach or liver fire, long-term retained food, stagnant chi, cold stagnation. Finally, treatment principles. So for the empty syndromes, very straightforward, just tonify the deficiency. Stomach chi deficiency, we tonify the stomach chi. Stomach 36, stomach 41, 42, Ren 12, bladder 21. So we've got the earth point on the stomach, we've got front mu point of the stomach, back shu point of the stomach. Stomach yin deficiency, nourish the stomach yin, see lots of the same points again. With the full syndromes, we need to remove the pathogen and descend and move the rebelling stomach chi. So we clear the pathogen, stomach fire, we clear the stomach heat or fire, transform phlegm, expel cold and warm the stomach, remove retention of food, regulate the blood, and then we stimulate the descending of stomach chi with points like pericardium 6, Ren 12 and 13, spleen 4. If we look at what sort of points we might use for clearing stomach fire, this is going to be even a reduction technique, expelling cold, warming the stomach with lots of moxa, removing retention of food, or regulating the blood. So you can see lots of points come up over and over again. So we've got stomach 21, which is level with REN 12 for all of those. The chi cleft point of the stomach, stomach 34. The front mu point of the stomach, REN 12. And the low connecting point of the spleen that feeds into the stomach, spleen 4. So we see that for all 4 of those syndromes. Thanks for listening.